To ease or not to ease? That seems to be the question amid the presence of Omicron, as health care experts largely agree it is milder than its earlier counterparts. But just how mild is it, and will it be the last variant of concern? To answer these questions and more, I have Professor Yu Byung-wook from Suncheon University. Professor Yu, it's a pleasure to see you again. I also have Professor Chi-Woon Bang at the University of Michigan live on the line. Professor Bang, welcome to the studio. Welcome to our show.
Hi, thanks for inviting me back.
Right.
And good to see you again, Sunny.
Right, Professor Bang, it's a pleasure to see you again as well. We'll start here in the studio then. Professor Yu, our daily tally on this Wednesday stands at over 400,000 infections, exceeding earlier estimates by healthcare officials in the country. Is this reality, Professor Yu, a cause for concern, do you think?
Well, I've expected more than 400, or even 500,000 this week. I've expected last week. How? Because, PCR capacity of Korea is 850,000 is the max. Sometimes a little more, but 850,000 is the capacity of the PCR. We can detect it around 30-40% mean. We get it around 0.3. Yes, millions people, we can catch it. But from the Monday this week, we are accepted professional rapid antigen test together. That's why I simply said last week, yes, probably from the Wednesday or Thursday, we can see sure around 400,000 cases confirmed as COVID-19 positive, even more can be. Why? Capacities of PCR, if we got it 50%, yes, that time we got it around 400,000 cases confirmed. As plus, now we are accepted as like confirmed, is a professional rapid antigen test is done, so add on. But you know what? Exactly, these days, in my calculated, every day at least 600 to 700,000 people are infected. But we just get it around 50%. So we are now in the big tunnel, middle of the tunnel. Probably in 10 days, we can see the end of this tunnel to show. But anyway, please don't be surprised. We can get it probably this Thursday or Friday. We can see more than 500,000 cases confirmed in Korea. But this one is mean not for spreading more. We just know, we just catching to condition what's going on. Only we just catching the cases.
Right, I see. And regardless of the situation here in Korea, Professor Bang, do you believe that the worst of the Omicron wave is over in most other parts of the world?
So that's a great question. Most likely, yes. But we are seeing a slight surge in the prevalence rate of the BA2, so the subvariant of Omicron. And so we'll see. I don't know how intense and the duration of the BA2 surge will be. My guess is it won't be that big. And I guess overall not too worried, because overall, we're much more prepared at this point because we have a much larger population that's immune due to high vaccination rates, natural immunity, and then we have a lot of other treatment options compared to when this pandemic first began. So most likely the Omicron surge is going to get better, but I do expect a small surge from the BA2 variant to come, but overall I think we're much better prepared for that surge.
Right. And back on the local front, Professor Yu, there has been a worrying spike in the number of fatalities here in the country. Having said that, how does Korea's case fatality rate amid Omicron compared to that of its international counterparts?
Well, in the case, the fatality rate is we are extremely low. But other countries, they are having counting of fatalities more than 1% close, but Korea is less than 0.1. But you know what? This is kind of statistics saying, but actually we are feeling in the hospital a little different, because now these nearly 200 more cases we have to announce it as like deaths because of Omicron or COVID-19 complication. In the plus, there are other cases like Omicron can be started, but already 7 or 10 days passed it, but still are suffering for the infection, respiratory conditions, and few weeks later, finally turned to be death. That case, how we can count exactly. That's why Omicron, yes, is compared to other variant, it seems to be mild. In the Korean, in the medical service system, we are depends well, but we cannot count it and we cannot judge in this moment because after Omicron waves, but still someone who are suffering, this is because of Omicron variant infection. But the problem is now facilities can kind of full, and the human resources manpower as medical power is not enough to take care of them. So doctors and the nurses, our medical profession in Korea, we have to decide every day who we have to take care of first. So it kind of ethical issues. So we are on the line all the way. So, but anyway, in statistics show Koreans, quarantines and depends well seems to, but we cannot judge in this moment. We have to see after finish this Omicron variant waves.
Right. Meanwhile, Professor Pang, many states over in the US have been rolling back, that is, pandemic-related public health policies, including mask mandates. Do you believe these efforts are in line, perhaps, with the current COVID-19 situation over there in the US?
I think so. We're seeing a dramatic decrease in the incidence rate of, COVID-19, the Omicron variant. I think the masks are not that helpful at this point, so I think it makes sense that we're removing the mask mandates. And again, as I emphasized, we're in such a different position compared to when this pandemic first began. Much better immunity in the population, much more treatment options when patients do contract COVID-19. And so we're just in a better place. And so again, I don't know. I do think COVID-19 will be with us for a very long time, and it will likely be an endemic virus. But I don't know if we need to be in this perpetual state of emergency at this point, at least here in the United States, because I do think we're much better prepared. I do think the important question that I don't know the answer to, and I don't know if anyone does, is what will be the next variant. I briefly mentioned the BA2 variant, which is like the little brother of Omicron. So it's a subvariant of Omicron. I do think that will surge a little bit. But again, I don't think it'll be too problematic. But what's after BA2? I don't know. And so that'll be the big question. But again, we're much better prepared. So not as too concerned as I was 2 years ago.
Right, like experts say, there are many questions and very few answers, of course. Professor Pang, have there been any tangible changes, perhaps, in the testing and treating of COVID-19 following the drop in Omicron infections there in the US?
There has, in the sense that during the peak of Omicron, what was happening was we didn't have enough medicines to treat our patients. Medicines like monoclonal antibodies or the oral antivirals from Pfizer and Merck. We were in short supply of these medications, so we would have to triage these patients and only give it to people who were at high risk of developing severe disease. So patients over 65, patients who've had conditions that weaken their immune system, patients who were unvaccinated. These patients would get the priority over these medicines over patients who were more relatively healthy. That has changed because, again, the incidence of Omicron has gone down so much. Now we are in a situation where we have enough medicine for most people who do get COVID-19. So that would be the big change that I'm noticing with this decrease in Omicron. And relevant to your treatment question, we just have a lot more supply now.
Right, well, that is good to know, of course. Meanwhile, Professor, here in Korea, authorities have allowed for COVID-19 to be treated under a regular regimen amid the onslaught of Omicron. What are perhaps the potential merits as well as setbacks of this new shift in treatment strategy?
Because this is only one way to a exit plan. Because you can guess 400,000 cases every day. We can calculate it simply. Probably there are at least 22 pregnant women should be delivered the baby, cesarean or normal delivery as well. Or more, around 30 patients who got a heart attack, they have to be receive the proper treatment to prevent all the heart attacks related to death, which means we have to switch for the in general world open for the patient with the COVID or doesn't matter what, because a number of patients now, nearly 1.5 million people stayed at home because of Omicron quarantine and isolations. But at the same time, that populations can help in something in their health issues, stroke, heart attack, I can tell for delivery something. That time, we have to prepare a certain space, is using as a general word. But before we use the level D, like astronaut protection PPE, but like this, we cannot handle it easier. So we need to potentially change the mind and concept. We can, like I say, pivot the systems. It's like attend for regular base seasonal flu. We can change the mind. Yes, Omicron, still we are worried about it because it is also kind of COVID-19 virus itself. Still the fatality more than a seasonal flu. But now in Korea, there are no way to another option because more than 2 million people going to be staying at home under this Omicron variant crisis. That's the time we have to be open for who got it Omicron, but who has health issues, not only for respiratory systems issues, and on their own health issues. That's why we have to open that we must have it treated because of number of patients got Omicron variant now.
Right, I see. And back in the US, Professor Pang, under a new COVID-19 response strategy by the Biden administration, Americans will be able to get tested for COVID-19 at pharmacies and, I quote, receive antiviral pills on the spot at no cost if they are infected. What are your thoughts on this initiative?
So that's what needs to happen because this disease, the key is to give these antivirals as early as possible. And so what the Biden administration is trying to do is trying to streamline this whole process so that when you do get a diagnosis, you don't have to call your doctor. You don't have to wait for the prescriptions to be sent to the pharmacy. You get the diagnosis, you can get the treatment on the spot. And I think their policy is trying to implement this very important concept because that's how you can make a big impact on disease severity with Omicron, early treatment. So it's a great idea. I don't know how it's being implemented. There will be a lot of implementation hurdles that they need to overcome. For example, certain drugs like Paxlovid, it interacts with a lot of drugs. So patients who are on a lot of medications because of other illnesses. And by the way, these patients who are on a lot of medications are the people who will benefit the most from these antivirals. You have to be careful because these medications will interact with this drug called Paxlovid, and if you don't have the expertise, there could be some serious drug interactions that can lead to potentially concerning medical events, and so we need to be careful for that. So it's a great concept. I wish it would work, but there's a lot of hurdles that does need to be overcome to make this happen.
Right. And Professor, you here in Korea, starting this week, rapid antigen tests, like you mentioned, conducted by medical practitioners, can serve as proof of infection. What do you advise amid this new testing strategy? Well,
before in Korea, yes, we can do self-tests or by the medical professional do the rapid antigen test. In case of positive, that time we have to show and we go to the PCR test. But from this Monday, the Korean government is like confirmed it's like COVID-19 positive. It's the same way. So professional rapid antigen test and the PCR. But there is one point. More than 60 years old who did the professional rapid antigen test can positive, that time is equal as like the PCR, you can receive the Paxlovid. But less than 60 years old who got it, the professional the rapid antigen test positive, but who want to receive the Paxlovid, they have to do PCR again. So this point, generally in health, and there are not things to be serious cases, yes, better to do the rapid antigen test, even more than 60, doesn't matter the age, and then start to isolate it at home. But who are less than 60, but whose condition seems to be not good, and who has underlying disease like diabetes, high blood pressure, and other condition, better to immediately to the self-test and show them to do the PCR directly. That's better. So anyway, this is a little more convenient and more site we open for professional rapid antigen tests more. That's why we can found it. We can just check it out. Amount of these waves going on, but don't forget about it. So the self-test is at home still not accepted. So please do at first at home. And if you have a symptom, please go to immediately for any clinic and nearby your home to ask about professional rapid antigen test first. And then we'll see your report.
Right. Professor Yu, the interval between the first and second doses of the Pfizer and Moderna vaccines is being extended to 8 weeks from the current 3 to 4 weeks under the recommendation of the Global Health Body. Could you explain this extension for us?
Well, so this vaccination is very new. Before, we didn't have enough the cases to can report the safety and efficacies. So we thought like Pfizer, 3 weeks interval, and the Moderna, 4 weeks interval can be enough. But we found some issues. A couple of weeks before, U.S. Health Authority, they confirmed the messenger RNA type vaccine can cause carditis and heart issues. So they will calculate which interval will be better for keep on efficacy and effectiveness, the same time less side effect. It's like a carditis. So they found that 8 weeks difference is much better, and so same with keep on their efficiency of the vaccination. This is the most important reason why. That's why from this month in Korea also 5 to 11 years old, the vaccination will start. First announced was a 4 weeks interval. From now on, we can call 8 weeks interval from the 5 to 11 years old children vaccination we started in Korea.
Right, I see. And Professor Pang, I hear cases of the so-called Delta Cron have also been detected over in the US. Could you tell us a bit about that?
So I think this Delta Cron was raised by certain scientists because it had some characteristics of the Delta strain and some characteristics of the Omicron strain. And I say certain characteristics, it was certain genomic characteristics that resembled Delta strain and Omicron strain. So they gave this strain a name called Delta Cron. So far, it's not a problem. It's less than 20 cases worldwide that's been reported. There's no evidence that it's more transmissible or more severe. I think the name is more scarier than the actual virus itself. And if you remember, and right now the strain that seems to be surging up is not the Delta Cron, but the BA2 variant, so the little brother of Omicron. And so right now, no reason to be concerned. But what this pandemic has taught us is always be humble. And, so I think it is important to just keep a close eye on it. But for now, no hard data to suggest that this is a concerning variant.
Right. Professor Pang, you've mentioned the subvariant of Omicron quite a number of times on the show today. How worried should we be about that little brother of Omicron?
Yeah. So I think this incidence rate does seem to be going up in parts of Europe. The United States, we're monitoring our sewage data to look at the genetic materia of the SARS-CoV-2 virus. And we are seeing a small increase in certain states with this BA2 variant. So I think a surge will happen. What I don't know is how big the surge will be and how long it will last. My guess, it will not cause much problems, but because again, we have just better immunity in the population. So I think this surge will be there. People will get infected, but people will likely not get too sick from it, leading to more hospitalizations. And again, we are better prepared. We have a lot more treatment options, monoclonal antibodies, oral antiviral agents. We just know this disease better. So keeping an eye on that, not too concerned, but always humble. Yeah.
Right, of course. And speaking about being humble, of course, then, Professor, Delta Cron has yet to be detected here in Korea. Do you suppose we need to better prepare for its presence in the near future?
Well, I 100% agree with the mention of Professor Pang, because Delta Cron is we don't need to concern so much, because each different strain from Delta variant and Omicron variant, we found these characteristics in each virus, but kind of we can call chimera. This is a fantastic the monster. That's why the media can make exaggerated to the Delta clone is like a chimera, so serious is like Delta, spreading is like Omicron. But actually, what Professor Bang comments about it, we don't have enough evidence, and there are more other issues for the spreading more fatalities. We don't have it. But yes, BA2, the little brother, I love this word, from the Omicron, stealth Omicron something. Yes, we have to prepare it. But anyway, this is now Korean government, we are waiting for the easing level of quarantine. So probably there are no way to prevent 100%. Only personal hygiene and wear mask properly and keep on social distancing at least March this year. This is only one way we can to preparing even the Delta clone others variants.
Right. Now, Professor Pang, you mentioned that you do not know if there's going to be another variant, but given your understanding of COVID-19 thus far, what then are the chances of a new variant in the near future?
Yeah, so I do not know if there will be a variant that's going to be leading to more morbidity and mortality, meaning that will there be a variant? Yes, I think I'm 99% sure that there will be future variants. What I'm not sure is, will these variants will become more problematic? Will it lead to more sickness in the future? That I don't know. In the big scheme of things, viruses tend to mutate to be less virulent but more transmissible, because it makes sense for the virus. You don't want the virus to become more and more deadly, because then the virus will just kill off its host, and that will lead to a decline in its transmissibility, because the host will just not be alive to transmit the virus. So in the big scheme of things, I think the variants will continue to emerge. I don't know if it'll become more and more aggressive, but my guess is it'll be less and less aggressive, maybe a little bit more transmissible. But with the immunity that we have in our population, my guess is it'll become less and less problematic, and it'll start becoming like your normal cold virus. Yeah.
Right, and hopefully your outlook will be accurate. All right, Professor Pang, as always, thank you very much for your time and your thoughts. Professor, you here in the studio, thank you very much for your insights.